When women come for a gynecological checkup, they really do not know what is expected out of them in that doctor's visit. So, in this video, I am trying to tell what doctors expect the information from women so that we can give them tailor-made treatment protocols exactly what will suit their body. I am Dr. Padmaja Clinic Vijayawada, and I have 25 years experience in this field delivering best women's health. We expect women to make a note of what is the chief complaint that they have and what else is troubling them. Otherwise, what happens is after the whole consultation is done, then they will remember that they have forgotten to tell us something. So, do write down what is troubling you the most in the order of what is making you uncomfortable, and we need details of every complaint. What is the trouble? How long have you been having it? Do you think there was some change in your life from where this trouble started? And how severely is it affecting your day-to-day living? If this information is there, we know what priority to write your medications on or investigate you for that. The next thing is we ask specific leading questions. These questions are for us to get information regarding how your other systems are working. Like, we want to know your general condition. We ask, do you have fever? Do you have excessive tiredness? Are you able to do your normal work? And then systematically from head to toe, we ask leading questions for all complaints. So, usually we ask, do you have headache? Do you have blurring of vision? Do you have nausea? Are you able to eat? So, like that, just imagine we are looking at your body from head to toe. Do you have breathlessness when walking? Do you feel excessive tired? Do you have swelling of your feet by the end of the day? Are you able to digest your food? Do you have any vomiting? Do you have any pain in your tummy? Are you able to pass urine normally? Are you able to pass your motion without any trouble? Has there been a change in your bowel habits? Are you having any loose motions? So, like this, these complaints help us know your body. And not only that, some intimate details like, do you have any vaginal discharge? Is there any itching? Do you have any problems with sexual intercourse? So, either you come out with complaints or do answer us these leading questions without taking offense. The next thing is, we would like to know your past history. In that, we would like to know any medical conditions that you had previously, any medications that you are on, and this is the best time to tell us if you have any particular drug or food allergies, any surgical procedures that you've undergone. And we usually have a checklist of all the things that are most commonly happening, like appendicectomy, DNCs, tonsillectomies, cesareans, tubectomies. So, these are the information we need to know so that we can have a comprehension about your total body. And particularly in a gynecological checkup, we are very much interested in your menstrual history. We need to know at what age your periods have started, how are your periods coming, how many days bleeding do you have, does it come regularly, is there any irregularity, do you have pain, how many sanitary napkins do you change, do you have any clots, do you have any associated urinary or bowel symptoms, has there been a change in your menstrual pattern recently, what was your last menstrual period, and at least 2 cycles before that, your previous menstrual periods. We would also like to know at any point of time, did you need to use medicines to regularize your periods or to bring about periods. So, this information tells us a lot about how your reproductive system is working. if if you're married and have had previous pregnancies, we would like to know the details of each and every pregnancy, because pregnancy is a very stressful journey for the entire woman's body. So we would like to know how your body coped up with that pregnancy. Did you have pregnancy? How many years after marriage did you have that pregnancy? What was the outcome? Were there any complications like excessive vomitings, high blood pressure, bleeding in pregnancy? Do you need to have any extra medications? Was your vaccination on schedule? How did you deliver your baby? If you had a pregnancy loss, it is all the more important that we have adequate documentation about everything that went along. Did you have any bleeding? Was any ultrasound scan done? All this gives us clues regarding what has happened previously, so that we can plan the next pregnancy. We would also like to know what is the form of contraception you are using. Are you planning any more children, or have you had any tubectomy, or has your husband been following any contraceptive measures? Along with this, we would like to have whatever previous investigations you've had, any medical record you've had. It is always advisable to bring us a photostat copy of your previous records so that we can go through them in detail. This is followed by a complete examination, and even the examination is a head to toe examination, because most of the time the only point of contact that women have is a gynecologist visit. So we check your height, we check your weight, we check your body mass index. Is your weight appropriate for your height? How much is your hip circumference? How much is your waist circumference? What is the ratio? Do you look anemic? What is your temperature? What is your pulse rate? What is your blood pressure? Along with that, we do a general examination of your respiratory system, your heart, and a complete examination includes examining your thyroid gland, examining your breasts, examining your tummy, examining your external genitalia, doing a per speculum per vaginal examination. As a part and parcel of your examination, it is always recommended in all women who are sexually active to have a pap smear, because that is the easiest cancer of the cervix that can be prevented by regular pap smears. By the end of your examination, we will come to a provisional diagnosis about what we think is wrong and what is causing you the trouble for which you came to us. And nowadays, an ultrasound of the pelvic organs is almost considered a part and parcel of your examination. That is usually done most often by the gynecologist itself. Then we can sit down and give you the medications that are specific for you, tailor-made for you, customized for your body, and investigations are suggested to keep a check on your rest of the body. With this, we can also formulate a plan regarding what we expect to do with your treatment protocol. This will be discussed with you along with explanation of the success rates of each of the technologies that is being used, what we are hoping to achieve with this, what are the adverse side effects, what are the alternative modalities of treatment that you can undergo. So, this much workup needs to be done, and every woman deserves this much care to maintain an optimum health. That is the reason gynecological visits are usually more time taking compared to general physician visits. I hope this has made it clear that we care for you, and you need to give us time and data to be able to give you good care. Wishing you all the best. Stay safe, stay healthy. Dr. Padmaja.